That's a common myth that people have, that you have to get this really huge impact to the head, or if you didn't lose consciousness, you didn't have a concussion. I'm board certified in neurology physical therapy, and I've specialized in working with people with any neurologic disorder, primarily people with concussions and vestibular disorders. I love working with these individuals with concussion. It's something that, it's an unfortunate thing that can happen, but the good news is most people get better. And so a lot of these people that have had delayed recoveries, that have had persistent symptoms for months, for years, a lot of times we can get them better in just a handful of sessions. And so being able to get them back to their life is just really important to me, and it really makes me enjoy what I do. Most people, 80 to 85% of people, their symptoms will go away within about 7 to 10 days, but there's this big proportion of people where their symptoms will stick around. So frequently, I'll see patients that have come to me, and athletes who it's been years or months, and they were just told that there wasn't anything they could do, or they just had to sit and wait for their symptoms to go away. And it's so hard to hear that when I know that if we just do our intervention and we do our exam and we get them on the appropriate treatment, we can really fairly quickly get them back to their normal life. You don't need to be an athlete to sustain a concussion. You can really get it with any activity in everyday life. Some of the more common signs are headaches and dizziness. You can also have sensitivity to light, difficulty thinking, a sense of fogginess, changes in your sleep pattern, irritability, some of the more common ones. There's more and more research that's coming out that looks like after a concussion, you're more likely to have knee injuries and ACL injuries. In the past, historically, people treated concussions with rest, and you were just gonna rest until your symptoms went away. But what we've really been learning more and more is that people that rest too long after the first couple days after a concussion have worse symptoms and delayed recovery. So the current recommendations are really moving away from rest and making sure that we're pushing a more active rehab approach to recovery. All of our therapists are going to do a comprehensive concussion exam with every single patient. A lot of places out there will say they're doing concussion rehab, but they're not looking at that full picture, and so they're gonna miss something and you're not gonna get better as quickly. After we do the comprehensive evaluation, we'll use that information to come up with an individualized exercise program for that individual. As the largest outpatient rehab provider in the country, we harness using best practice and the most up-to-date literature to make sure that we've got the most comprehensive concussion program to get the best outcomes.